Hey, everybody, welcome to today's episode. Got a great episode here with Pablo Diaz, who is the CEO and founder of Blossoned. Pablo's actually in Mexico City today, visiting his parents, which is really cool. But I think you live in Austin, right, Pablo?
Yeah, I live in Austin. I've been there for 10 years. I went there for college, and since then, I've been most of the time there.
Great entrepreneurial and venture capital scene in Austin. So you're in a good place.
Yeah, it's definitely a tech hub, and I think a lot of opportunities and great people.
Cool. So let's just start. Tell us a little bit about Blossomed and your Open My Doctor platform, and feel free to share, a little bit of slides or anything to help the audience understand it.
Yeah, so I guess I'll start with the purpose on why the problem that we are solving with Blossend's Open My Doctor. So basically. Uh, Open My Doctor, what it's doing, it's bridging the gap between any health and wellness professional, and people needing um, health support of any kind. So basically, it's a very intelligent bridge between the supply and demand of the health system.
Yep.
It's a big problem in the U.S., especially. I mean, it can improve in other places, but in the US, there is a lot of barriers to finding the right care, and yeah, a lot of steps you gotta go through. And what we're doing is we are democratizing access to different health support and making it also transparent. That's why it's called open. It
Right.
opens the doorways to it. So that's basically in a nutshell what our mission is
Okay.
with Blossend's platform, Open My Doctor. And do you want me to give you a brief background on?
Yeah, sure. Yeah, be great.
Um, yeah, so I'll just very very brief, pass through the kind of like from when we started. So early 2023, I started, putting together a team of highly talented and intelligent engineers. It was a learning experience because a lot of bootstrapping, interviewing, talking to different people, and knowing what specific talent you need. So that was the beginning phase of building Blossom. Um, so that went really well. A lot of trial and error, and then right away we started building the platform. So since then till late 2024, yeah, things were moving steady and good. But then late 2024, that's when we started seeing a huge amount of traction.
Oh, cool.
A lot of users, everything organic. So a lot of from word of mouth to just other just internet exposure and different platforms. We started getting um, around 30 to 60 or 70 users per day. So it has been growing a lot since then. And right now we're close to, we're at the 15,000
Wow.
user base. We're working to get customers and to get more customers enrolled. And also we are open to funding.
Good.
There's been interested investors that we've been talking to. So that's just very brief fast through
Okay,
of
cool.
where
Good.
we're at now.
Good. Yeah, do you want to show us the platform a little bit? Give us a little tour just to
Yes.
get the taste.
Let me know if you can.
Yeah.
Um, yeah. So basically, let me just and I'll go to a small video demo as well. But
Sure.
um, yeah, I'll just these are like the key screens here. You can schedule appointments and pay. Um, you can set reviews, bookmark doctors. Here is the home screen. So basically, search intelligent search. So that's just like a very you know brief demo of what we have. I'll just play the video. It's
Sure.
it's gonna play pretty quick, but here you can see how a user is searching through a doctor is looking for nearby help, and you can see here the distance, the amount of ratings. The user can also showing how you can democratize the information about doctors and just basically be able to choose the best health support out there. There is filtered search. It's very intelligent search that we have. So I'll just stop here to go briefly about this. But basically, we use AI for prompting the best doctors out there. So there is in-network Blossend doctors that are affiliated with us that have joined the platform, and those have more visibility. They receive more support from our end, but there is also over 1 million doctors that you can search that are not affiliated with us, that are just like external doctors. So there is a huge database of health support you can get there. And when I say doctors, I mean also health and wellness professionals,
Sure.
gym trainers, therapists, all types of health and wellness professionals. So it's an intelligence search that works really quick, and it shows you what's available right now in the quickest possible way. So that's just a brief overview of everything.
Great. And so when you have 15,000 people on it, these are basically patients that are looking for providers. Is that how you measure it?
Yeah, 15,000 users that you could see them as patients. They can find any health and wellness professional there, and they can pay through our app, although it's not limited. Here you can see in that screen. Basically, you can connect and message doctors, so we remove the barrier of having to pay through the app. It can be outside the app, just to allow more flexibility.
Cool. So what was the inspiration behind this, Pablo? Just tell us a little bit about it, because I know you had, you graduated, I think, University of Texas computer science, had, worked in Amazon, and then kind of, hatched Blossoned. So tell us a little bit about your inspiration.
Yeah, so I graduated from St. Edward's University, but I did a coding course in really good coding course in UT.
Yep.
Also, some background in UC Berkeley for math. But yeah, the inspiration behind this, I think, is mostly like the pain to find health support out there, basically to find healthcare, having it accessible and transparent. There is a huge amount of talent out there from health and wellness professionals, and there is also a huge amount of demand. So big supply, big demand, but there is no really intelligent bridge between it, connecting them. So there is a lot of wasted potential, and also people left behind, not getting treated.
Cool. And so tell us a little bit about where you are today and where you see yourself heading in the next whatever 2 to 3 years. I guess it's hard to sometimes project that far, but I'm sure you've thought about it.
Yes, yeah, we have a very very long-term roadmap. Obviously, the farther it goes, the more high level, and also the more resources we need. Right now, our immediate next step is to release version 4. It has a lot of features. It's going to have enhanced AI search, where the app is going to know you really well as a patient. It's also going to know the doctor. So it's basically going to give even more accurate. It's going to give more accurate search results. So knowing your budget and location, everything, even better than it does now. Right now, it's pretty good. The search, I would say, it's one of the best out there. It gets the job done really well. And then farther along, there is features like there is many of them, but I think one of the most exciting ones is the ability to replace a cancel appointment with someone that needs help. So our mission, bridging the gap and connecting supply and demand so that no supply and no demand gets wasted in the process when things get in the way. So yeah, we will basically open, let's say, appointment gets canceled from a patient 2 hours before it happens. We're going to promote that so that someone else seeking the same help, especially when it's more generalized, that gets filled, and that's a win-win for providers and patients or people.
Cool, cool. Tell us a little about your value prop and your business model, Pablo.
Yeah, so we have actually a very robust and solid monetization plan and business model. Obviously, we make it as human as possible in the sense that we don't just put profits over results or people. It's like you can get both. You can get profits as well as help people out there. Supply and demand, both of them. Our monetization plan, the core of it, the beginning of it, it's coming from the health and wellness professional side of things. They enroll, they can get, they can use our platform for free and get a lot of benefits from it for free, but they can get even more if they are subscribed. So there is a Solo Pro membership that is $99 per month. If they subscribe in that, they get more support from us, more visibility. They get more, white label branding. So it's, high level. There's also clinics that, we're working with some, hospital owners and, talking out there with some clinics and, trying to working on getting them on board. That's going to be the clinic plan, which is the Team Care Clinic plan, and it starts with three professionals. That's like the minimum, and it goes, all the way to 10 or more.
Gotcha.
So that's the core monetization plan. There is also like the bookings and stuff like that, but that's more in the smaller side of things.
Yep. Great. So I know you were recently in Spain. You're doing some fundraising. Tell us a little bit about just how that went. I mean, I know I hear from other health tech founders right now that can be a bit of a challenge. What challenges and maybe what encouragement did you see in the process of doing that?
Yeah, and I think it's interesting because the first time we connect over a call, that was like pretty soon after I met with these investors. It was the stakes were pretty high. They wanted to we're talking about like a $2.4 million dollar deal, and the stakes were pretty high. We ended up not moving forward. There were some strange things there, from like the terms and things didn't really click. But I think overall it was still a really positive experience because just going flying across the planet just to meet with highly interested investors that want to put this huge amount of capital in the startup. I think that just makes it not just exciting for my team and I, but also even get us to prepare even further. We went through a couple of discussions, and I think the experience was positive overall. Is that I kind of got a little bit out of the way, but did I answer your question?
Yeah. So what were maybe like some of the questions that they asked that maybe you didn't expect? Once you go to a pitch and you kind of know what you kind of know what you got to cover, but what was unexpected?
Unexpected. Well, I think there were a couple of things that made us not move forward with them. I think the lack of transparency from their end. They were family office from Switzerland, and they wanted to kind of like move forward with a lot of steps without disclosing enough information. So privacy is important, but like they didn't want to disclose, for example, who their investor is. So they are the family office. They manage a lot of investors out there, and one of those, the one that was very interested in this deal, if they want to share that information, I think for the most part they did have the expected kind of questions such as metrics, forms of numbers, revenue, um, but there were some you know um, um, things that didn't click from their
Sure,
end.
sure. So as you built your business and as you scale it, what are maybe the top, one or two challenges that you've encountered?
I think there's been many challenges, from technical challenges that can be frustrating, things breaking, database, server, stuff like that, where you're gonna have a long day. When something breaks in the morning, you're gonna be sitting down for like 15 hours, fixing it. So that's more from like the technical side of things. I think from the more like human side of things, like team building and all that. Um, One of the um, learning lessons, or I guess challenges, and also like learning lessons that was very valuable is understanding how important the team is,
Yeah.
but also you don't need a huge team to accomplish a lot of results. Initially, we built a pretty big team, and we realized that that was not the smartest choice. So basically, having smooth communication and people that are ready to just creative people that are just action takers and good at teamwork.
What about AI? So has the ability to generate code with AI been a huge benefit to you then?
For for like the search, and so internal to the app, that helps uh the search and a few other things. Externally also helps, you can get things done much faster, from uh writing things, not just code, but all types of things. It's just having a very intelligent assistant. So I think, leveraging on that, it's is definitely valuable.
Cool. So this has been a really interesting interview, Pablo. Just in closing, again, maybe what are the top, two or three lessons that you would share with other founders, maybe even people that, are contemplating this journey. What would you tell them?
Well, I think just being prepared to facing like a lot of roadblocks in the way. It's much more challenging than I think, or even if it seems challenging, it's the actual experience is even more challenging than that. So just being prepared to sweat a lot and go through some just the ability to put that much work, and you gotta be fully committed, put
Yeah.
skin in the game. I think that's one of them. I think another one, this is more of like a business recommendation that has worked for us, is just to not spend much time out there looking for investors, but building a business that is scalable, and
Yeah.
that people want to use that platform. So, and then the investors um, come to you. So I think, not spending like too much time doing taking the investor route and then neglecting the product building, or that side of thing. Um, and I mean, this one might sound a little bit basic, but just having a solid lean team is very important.
Right. Cool. Well, Pablo, thank you so much for sharing your story, and congratulations on your success to this point. I know it's very difficult, and wish you all the best of success going forward.
Yeah, thank you so much, Darian. I appreciate your time, and inviting me to this podcast.
Excellent. Take care.
You too. Bye.